As children, we all had experiences playing pretend. Most like to play house, others like to play school, but me, I always played doctor. My favorite part was using the stethoscope and pretending to hear the sound of the heartbeat while my patient whispered, bump, bump, bump. Well, now that I'm a real grown-up doctor, I can hear those sounds every day, but I know that they're not just bump, bump, bump. There should in fact be two different sounds going lub-dub, lub-dub, lub-dub. But sometimes other sounds make their way in there, and that's where things get interesting.
So a heart murmur, the word murmur means a noise, a sound. A doctor listens with a stethoscope and is listening to your chest and hears a little sound. So there are different valves in the heart. The main valves that we listen to with the stethoscope are called the mitral and aortic valves, and they're in the right upper chest and towards the under the breast. The valves are thin little pieces of tissue that are very flexible, like say our earlobe, and they move and they open and close. And under normal circumstances, if the valve is thin and smooth, the blood passes through it and there's barely any sound at all. But if the edges get a little bit rough, either just through the ears or because of some calcification on the tip of the valve, or if the valve stretches too much and doesn't close tightly and a leak develops, then the doctor can hear a little whooshing sound as the blood leaks or goes through some roughness or turbulence through the valve as it opens.
A heart murmur sounds kind of scary. I don't want my ticker making any extra sounds it's not supposed to. But how do we know if a heart murmur is dangerous? Well, doctors start by classifying heart murmurs with different characteristics. Timing. When does the heart murmur occur? Is it between the lub and the dub when the heart is contracting? That's called systolic. Or is it between the dub and the lub when the heart muscle is relaxing? That's called diastolic. Location. Where on the chest do you hear it best? Radiation. Where else do you hear the sounds traveling? In the neck, perhaps. Intensity. How loud is it? Do you have to listen really carefully, or can you hear it when the person walks in the room? Shape. If you were to draw it out like a sound wave, what would it look like? Long? Short? Does it get louder throughout, or start loud and trail off? And finally, pitch and quality. Does it sound like a high-pitched whoosh or a low rumble? If a doctor or nurse hears a murmur, they will often do other tests that can more visually evaluate the heart and the blood flowing through it. The most important of these tests is the echocardiogram, which is basically an ultrasound of your heart.
So a skilled cardiologist, medical doctor who's skilled at listening to heart murmurs and have an excellent sense what's going on just with the stethoscope. However, in today's technology, we have these sonograms and MRI machines that can actually look inside the heart and see exactly precisely what's going on. See if the valve is thick, see if the valve is not closing well or is leaking because the edges have frayed a little bit. And these tests the doctor may order, called an echocardiogram, will tell us much more precisely what's going on.
Now, before anyone freaks out, know this. A heart murmur is not a disease. It can be a sign that there's something wrong with the heart, but plenty of people with heart murmurs have no other signs of heart disease.
That sound, the word murmur, does not mean disease at all. It just means we're hearing a sound. And when a patient hears the word murmur, that doesn't mean that there's a cause for alarm at all. Many murmurs are innocent sounds that change through our aging process. An innocent murmur is the sound that we believe is not a health concern. And so there'd be virtually no restrictions, full sports activities, excellent prognosis, and maybe a normal finding. So the word murmur doesn't necessarily imply a disease at all.
Innocent heart murmurs can arise out of pregnancy, aging, and illnesses like anemia or hyperthyroidism, which cause the blood to flow through the heart faster than normal. In those cases, you don't fix the murmur. You treat the underlying problem, and the murmur goes away.
The need to treat the heart murmur is if the valve is becoming so thick that it has trouble opening. If the valve really has so frayed on the edges that there's a moderate or severe amount of leaking. If these problems develop, It can interfere with your full activities. There may be shortness of breath, there could be palpitations, there could be chest pain, there could be a sense of feeling faint, particularly in older patients with severe valve problems, and that may require one of many different treatments that the doctor would have to make a plan for.
Abnormal heart murmurs, the ones that require direct intervention, are most commonly due to holes in the heart or defects with the heart valves.
There are so many murmurs in today's world that many things can be done for, and including people have heard of valve replacements where they need surgery. There are new technologies the past recent years that have been able to dramatically change and improve valve function without true surgery. So as patients hear about heart murmurs, or parents or grandparents with severe heart murmurs, very often today there's been a revolution in minimally invasive techniques to improve the function of heart valves with less risk and much easier recovery times than we have in just recent years.
Murmurs can disappear. Often, children born with heart murmurs will lose them as they grow older. It's always important to have your doctor check out your murmur. If you know you have a murmur and it's been checked already, let any new doctor know. It could save a lot of unnecessary tests and worry. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Lub-dub to you, sir.